Hi, my name is Dr. Stephanie Saucier. I'm a cardiologist, and I diagnose a lot of patients with atrial fibrillation, or more commonly known as AFibs. I made this video to help explain treatment options for atrial fibrillation and hopefully make it easier for you. So let's jump right in. Everyone needs a different type of treatment to manage their AFib, specific to you as the patient. We want to make sure that we're treating you and your AFib specifically for what other health conditions you have going on and also your preferences. The first way that we treat atrial fibrillation is with lifestyle changes. So for example, making sure that you're exercising regularly, managing your weight. Obesity can drive atrial fibrillation. Other things that can drive atrial fibrillation are untreated sleep apnea. So that's something we want to make sure we treat. Sometimes patients are more sensitive to caffeine. The other thing that is very common from a lifestyle standpoint is minimizing alcohol intake. For patients with atrial fibrillation, we do know that increased alcohol intake does increase atrial fibrillation. We try to either stay away from alcohol altogether or minimize your alcohol intake to 3 drinks a week. That would be the maximum amount of alcohol intake in someone with atrial fibrillation that I would be comfortable with. Medications are the second mainstay of how we manage atrial fibrillation. It's really important to recognize what your stroke risk is if you have atrial fibrillation. That is one of the biggest things that you and your doctor are going to talk about with the atrial fibrillation. What degree of risk do you now have to developing a stroke? A lot of times, patients who have high stroke risk, we put you on an anticoagulant or a blood-thinning medication to try to minimize that risk. We also may use medications to either control the heart rate or to try to get you back into a normal heart rhythm. There's 2 different schools of thought. The first is something called a rate control strategy, where we know you have AFib. We want the heart rate to be controlled. We want your heart rate when you're resting to be less than 100 to 110 beats a minute. We may use medications such as beta blockers to try to slow that heart rate down. Now, the other school of thought is what we call a rhythm control strategy. A rhythm control strategy is where we try to get you out of atrial fibrillation and prevent you from going back into atrial fibrillation. And so there's 2 different options when we're talking about the management of medications. It's, do we want to keep your heart rate slow but allow you to stay in AFib, which may be right for you? Or are you someone who being in a normal sinus rhythm or a normal heart rhythm is better? People who might benefit better, a rate control strategy, or patients who, 1, prefer to be just controlled rate. 2, who don't have significant symptoms, might be older. They might have something called a larger left atrium or more changes to the heart that'll make it harder for us to get you back into normal rhythm. And maybe someone who also has been in atrial fibrillation for a long time. The longer you're in atrial fibrillation, the harder it is for us to get you back into a normal rhythm and then keep you there. So those are some characteristics of someone who might prefer, with the assistance of a doctor, a rate control strategy. Now let's flip on over. The rhythm control strategy, patients who might do better with a rhythm control strategy, we have these conversations with our younger patients, people who have a shorter history of atrial fibrillation, so if it's newly diagnosed, patients with a history of heart failure, people who have to prefer and do better with a rhythm control strategy. When we're talking about a rhythm control strategy, there are medications we can use, such as anti-arrhythmic medications, and some people prefer something called an ablation. Ablations are more invasive procedures where electrophysiologists go in and correct where the atrial fibrillation is arising from, whether it be with cold therapy or burning therapy. They try to block that atrial fibrillation from coming back by scarring or blocking those channels in the heart. Again, this is an invasive procedure, but new data has supported that atrial fibrillation ablations are safe and can be considered as first-line therapy in someone diagnosed with atrial fibrillation who wants to undergo a rhythm control strategy. Sometimes, if you're not ready for an ablation, what we can do is something called a cardioversion. We actually put you to sleep and then shock the heart back into a normal rhythm, and then follow that up with anti-arrhythmic medications to try to keep you out of atrial fibrillation. The key is coming up with a plan with your doctor and being educated and knowing what your options are. Sometimes you may have to combine all three options. You might have to combine lifestyle changes, medications, and a potential procedure to really manage your atrial fibrillation. But what we know is that if you work with your doctor and follow all the tips that we recommend, that you can live a very happy, healthy, long life with your atrial fibrillation. Patients who manage their atrial fibrillation well typically have less atrial fibrillation episodes and again, live a much longer, healthier life. If you found this guide helpful and want to learn more, please like and subscribe and comment so we know what to make next to help answer all your questions. If you want to get our heart health guide, please click the link below.